So Professor Louise Maple-Brown from Menzies School of Health Research in Darwin. So I'm presenting on our EGFR study today in the epidemiology session this afternoon. This is a study that we've been running for more than 10 years. It's a partnership between clinicians and researchers and communities across northern and central Australia. The study was started back in 2008-2009 to assess the accuracy of the standard test of kidney function in Aboriginal and Torres Strait Islander people. And the study involves 600 Aboriginal and Torres Strait Islander people from across north, central, western and far north Queensland as well, Australia, so from 20 remote community sites. And yeah, it's a great honour and opportunity today to be presenting results from the study over the last 10 years and also to let people know how we're continuing to work with communities on the next stage of the study as well.
And what did you find in this study?
Yeah. So the first stage of the study, we found that the standard test for kidney function, the blood test, is accurate in Aboriginal and Torres Strait Islander people, so there doesn't need to be any changes, which is good news. It's the standard test that all laboratories use. So we reported that that was accurate for Aboriginal and Torres Strait Islander people in Australia, which is important news, that test is an important test of checking kidney function. And then in the next stage, the follow-up stage, we came back to see people 3 years later and we looked at factors contributing to progression of kidney damage. And we reported there that albuminuria, so the test of the urine for early damage, is an important marker and contributor to progression of kidney damage. So the important message there for communities is regular checkups of blood and kidney, and with the health clinic to check diabetes and kidney disease, even if you don't know it or you don't think you have any conditions. Regular checkups are important. The rates are about 15 times higher of end-stage kidney disease in Aboriginal and Torres Strait Islander people than non-Indigenous Australians, and particularly in remote Australia, so the areas of our study, rates are up to 20 times higher. So that is why we've particularly worked with remote communities in Western, North, Central and North Queensland, Australia, because they're the places of Australia where we really have the highest rates of kidney disease among Aboriginal and Torres Strait Islander people. Research, it's obviously it's a really important part, but the key message is that it's important to listen to communities and clinicians around what are the research priorities. So that's what we've been doing over the last few years, is talking really closely and working closely with community partners to hear from them about research priorities around kidney disease, to then inform the design of the next phase of the kidney study, which we've now just applied for funding for, and we're waiting to hear the outcome of that funding result there.